In this video series, 3D MedNet is with 3D Life Prints at Alder Children's Hospital in Liverpool. We're talking to surgeons about how 3D printing helps them solve the most difficult of cases. In this video, we're talking to Rafael Guerrero. He's discussing how 3D printing has helped him solve the most complex of cases.
It's not just important to have 3D printing, but to choose the right material. And the material to be used, it can vary for different particular objectives that you have for 3D printing. One could be for training, preoperative planning, etc. But for training surgeons, what we have developed is the type of material. And in this case, this is a model of the chest wall with a heart inside to replicate. It's kind of similar to how we operate. So if we have this heart, this is obviously a different material, which is flexible. This is, again, the part of the actual patient's heart, with a malformation called tetralogy of Fallot, in which is a hole in the heart and is a narrowing of the artery going to the lungs. And what we've done is we've done the operation in the 3D printing model. The advantage of this gives me is that by working with the technicians who develop this, we can choose the right material and we actually can do the operation. So in this case, we have put up artificial patch stitched with a special suture, exactly the ones that we use in the operating room, for the trainees to practice before we do the actual operation. There was no way to train them except to train in real life, so with a real patient. And the way that we used to train is a long learning curve, in which you have to take a long time, in which you as a consultant supervise them and then work together slowly until they gain the skills to perform the operation. But it's impossible to create a model of this type in a piece of paper to do it. So that's going to make a difference. If you choose the right material, we should be able to overcome what was in the past, meaning like nowhere to practice. I think the way we evolve is that several specialties, not just heart surgery, but the brain surgeons, the spine surgeons, all of them will be using more and more often to help them with the final diagnosis, and specifically in more complex cases. It cannot be the routine ones, but in the most complex cases, for different areas, for us to be a source of education for the public and for the different universities around our area, or in the north of England, or in the whole country. And so we can use our archive of 3D printing part of the body for them to learn. But from the everyday practices for us as consultants or surgeons or clinicians is to actually plan our operations. So in the future, I've foreseen that we will be able to order, if you want to call it, in the same way that I order an X-ray or a CT scan or an echocardiogram, and I order 3D printing of this model. The next thing will be not just to see that as a part of a routine part of the process, which hopefully will be funded by the NHS as another source of imaging of the body, but to be able to sterilize them. And so when we are in the operating room, we are able to use, at the same time that we are operating, have a look at them inside as well. So I've foreseen that that's the use of 3D printing in Alder.